So the major question that people have when a spot or mass is in the lung is this cancer or is it benign? And the good news for the majority of people are most of these spots are benign. But of course, the important aspect is to detect when something is malignant, when it's lung cancer, because if we detect it early, that's the best chance that we have to treat it. A scan by itself cannot tell whether a spot is benign or malignant. We need a whole host of other information, the history of the patient, the age, their smoking history, other exposure history that might relate to both a lung cancer risk or a risk of other reasons to have spots in the lung. And so a scan can give us a lot of information in terms of what it looks like, but it has to be in the context of the whole patient and the rest of their medical history. Ultimately, we may need to consider a biopsy. And a biopsy is not necessary in every patient. A biopsy is necessary for patients who there's a lot of uncertainty about what it is, but sometimes a short interim follow-up or a short interval of follow-up may be even better than a biopsy to see if a nodule is persistent or growing or whether it's maybe going away. And if something is a very high risk for cancer, oftentimes we will decide specifically not to do a biopsy because the risk is so high of cancer that if a biopsy did not show cancer cells, we would tend to not believe it and think that we may have missed the cancer cells on the biopsy and recommend treatment anyway. So particularly if it's a cancer that can be removed surgically, oftentimes we would decide to go straight to surgery to remove a very dangerous looking spot that we think is lung cancer. So when we have a person that has lung cancer, either diagnosed or very suspicious, the first thing that we do is we want to stage the cancer. Staging the cancer means we put it into a category of how advanced the cancer is, and it's important for patients in terms of examining what their options are, what their prognosis is, and what the different treatment choices may be, because they're different for different stages. In fact, is probably the most important thing that we do in having successful outcomes in lung cancer treatment is successfully staging a patient and doing it correctly at the beginning. The earliest stage is stage 1, which is a very early stage cancer and is usually treated by surgery. The latest stage is stage 4, which means a cancer has gone to other parts of the body. In stage 2 are intermediate cancers that have often gone to nearby lymph nodes but have not spread further. And stage 3 is maybe the most complicated part of lung cancer because it's what we call locally advanced, a cancer that is more advanced in its stage, but is also still treatable for potential cure. And it's those patients that often require a very aggressive type of multidisciplinary management that includes all the members of the team. So stage 1 is pretty straightforward to figure out how to manage, and stage 4 is. Stage 2 and 3 is often multidisciplinary and uses the full spectrum of our team in caring for them. And as I said before, stage is probably one of the most important things in terms of picking the right treatment for the right patient and giving them the best chance to be a lung cancer survivor.